I want to say good evening and welcome. This is class number 7, I believe, with 3 more to go. So we're really excited to keep the ball rolling here. This is a different class than we've had recently. A little bit of departure because Dr. Baritz going to talk about utilization of acupuncture with our canine friends. So I want to turn it over to Dr. Baritz.
Hi, great to be with you today, and I really am happy to presenting this this presentation on animals. Once I really got into acupuncture and I saw all the miracles that it could do, I started thinking about, well, how about animals? Could it actually help them? And as it turns out, and you'll find out shortly, there's a long history of use of acupuncture animals dating back quite far in China. Typically animals of war like horses were the first animals to get this type of treatment. So let's take a look at how to stop dog separation anxiety quickly. Separation anxiety is defined as the fear of being away from the primary caregiver. Separation anxiety is triggered when dogs or cats become upset because of separation from their guardians or the people they're attracted to. Escape attempts by dogs with separation anxiety are often extreme and can result in self-injury and household destruction, especially around exit points like windows and doors. There is no conclusive evidence on why pets develop anxiety. Because dogs who have been adopted from shelters are more likely to have separation anxiety than those kept by a single family since puppyhood, it is believed that the loss of an important person or group of people in a dog's life can predispose the dog to separation anxiety. Other changes are known to trigger separation anxiety, such as a change in schedule, a change in residence, or a change in household membership. What are the signs of separation anxiety? Well, dogs are disruptive or destructive when left alone, or when their caregiver is attempting to leave and might urinate or defecate, bark or howl, chew or destroy things, dig, try to escape pace, and even attempt to prevent you from leaving. Other signs of separation anxiety include what I'll cover in just a moment. Although problems that we just mentioned are often indication that the dog needs to be taught polite house manners, they can also be symptoms of distress. When destructive behaviors are accompanied by other stress behaviors, such as drooling and showing anxiety or depression when his pet parents prepare to leave, it is likely that the dog has separation anxiety. How to help? We call this working with nature. Give your pet a treat when you're going to leave. Make your comings and goings low key. And leave out some recently worn clothing with your smell on it so the dogs can snuggle up and feel comfortable. Dangerous treatments, we call this working against nature, providing medications and shock collars. I also recommend supplements and acupressure. Canine supplement dosing is usually based on weight. A small dog is a dog that's less than 23 pounds. A medium dog, 23 to 55 pounds, and anything over 55 pounds is considered to be a large dog and gets large dog dosing. And here is the handout that I prepared for your patients. And you can see they can click right over here to get to the video we'll see shortly. And here is the canine anatomy and direction sheet. And we go over terms such as dorsal and ventral, dorsal, of course, being the back of the dog, and ventral being towards the belly, cranial towards the head, and caudal towards the tail, as well as proximal towards the body and distal away down the extremity towards the paw. And here are the 2 points that we use for separation anxiety, heart 7 and small intestine 3, and we'll cover those in much more detail. Here are the supplements for separation anxiety. As you can see, they're dosed according to the dog's weight. And we'll go over these in just a couple of minutes. And over here is the disclaimer to remind people that you're not a veterinarian, you're not providing veterinary advice. Now, as an aside, Massachusetts chiropractors are allowed to treat pets as long as they have a note from the pet's veterinarian, and as long as they treat the pet in an area or in a location that they are also not treating humans, and this is for sanitary purposes. Typically, if a patient wants me to treat their pet, I ask them to drive up to the clinic. They give me the note from the veterinarian, and I'll either treat the pet in the car or just in the parking lot. Now, I prepared a course for pet owners or pet parents. It has several modules: introduction to dog acupressure, how to use acupressure to help your dog, how to reduce dog anxiety, how to fix dog digestive problems, how to help a dog in pain, how to relieve dog arthritis, and how to help your dog be happier. Let's get to the supplements and acupressure. And the first supplement is Orchex. A small dog would have a dose of 3. A medium-sized dog, that's a dog 23 to 55 pounds, would have a dose of 4, and a large dog over 55 pounds, a dose of 6. Orchex, as we know from treating humans, provides a potent calming effect that helps maintain emotional balance. Orchex also encourages mental clarity, enhances the ability to relax, and allows for greater ability to handle life stresses. Orchex also supports the balanced function of the nervous system, and in males, it supports healthy testicular function. It does not provide similar support for the ovaries of females, and if the male has already been fixed, then it won't provide this function. However, we're not really looking at it for that. We're looking at it for the calming effect. Mintran is the other really important product, mineral tranquilizer, what we in the nutrition business call it. And a small dog less than 23 pounds would get 6, a medium dog 23 to 55 pounds, 8, and a large dog 12. Supports a healthy nervous system. It's a mild calmative that helps maintain emotional balance, helps ease the effects of temporary stress, and supports actions of neurotransmitters that support mood. Also consider Neurotrophin PMG. This is especially for dogs that have a history of trauma and perhaps head trauma. Small dog getting 1, medium dog 2, and a large dog 3. And it supports healthy nervous system function and promotes recovery after concussion or head injury. And Neuroplex, this is especially for dogs that tend to overeat. A small dog would get 1, a medium dog 2, and a large dog 3. And so if you have the combination of separation anxiety and a tendency to overeat, then Neuroplex should be part of this pet's program. It provides a broad spectrum of minerals, vitamins, and complementary tissues to support endocrine gland function. Now let's take a look at the video showing how to locate the points, stop dog separation anxiety quickly.
Hello. In the next 2 minutes, I'm going to show you how to reduce separation anxiety for your dog. Is your dog disruptive or destructive when left alone? Does your dog urinate, defecate, bark, chew, or try to escape when left alone? It could mean that your dog has separation anxiety. Common remedies include giving your pet a treat when you leave, making your comings and goings low-key, and leaving out some recently worn clothing so your dog can smell them, as well as herbal remedies and certain supplements. Some dogs are given anti-anxiety medications which can cause other problems. And sometimes they'll give dogs an electric collar to shock them, which I don't recommend. Fortunately, acupuncture has been used to help animals for thousands of years. My name is Dr. Baritz. I'm a chiropractor, nutritionist, and herbalist, and I'm certified in acupoint physical medicine. Like you, I'm a dog lover. I've helped thousands of people live healthier and happier lives, and I want to help you and your dog too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos like this come out. And to access the companion quick reference guide for this video, see directions in the description below. To prepare your dog for the acupuncture session, do what's necessary to reduce or eliminate possible interruptions. Next, select a suitable location where you and your dog feel comfortable. Now bring your dog over and let him or her know that you want to give them a treatment. If your dog doesn't seem receptive, try 1 or 2 other locations. If your dog still doesn't seem interested after trying 3 times, just skip it and try another day. Once you and your dog are in a comfortable location, then you're ready to begin the treatment. During the treatment, your dog can be standing, sitting, laying down, or any combination that works for both of you. Dog acupressure treatments use 2 hands, the active hand that's doing the treatment and the passive hand that's resting on your dog, providing support and comfort. Like this. Passive hand, active hand. The acupressure treatment is started by activating the powerful bladder meridian. The bladder meridian starts up next to the eye, goes down the body, and ends on the back leg. To activate the gallbladder meridian, we start just below the head, putting the passive hand on the body, and you stroke firmly down the dog's body to the bottom of the back leg. Do this at a speed that is comfortable for your dog. It's done 3 times, like this. Now, activate the bladder meridian on the other side of your dog's body, like this. This starts the treatment and signals your dog that this is not a normal playing or petting session, but something special is happening. Now, let's activate small intestine 3, which is the first point we use for reducing or eliminating separation anxiety. Small intestine 3 is known as backstream because it helps your body recover after exertion. In addition to helping with separation anxiety, small intestine 3 is traditionally used to treat pain in the eye, forelimb pain, neck pain, and spinal pains. Small intestine 3 is found on the small intestine meridian. The small intestine meridian influences digestion, water metabolism, and bowel function. The small intestine meridian starts at the outside of the front paw, right about here, goes up the leg to the shoulder, up the neck, and ends just in front of the ear, like this. To find small intestine 3, start at the last toe on your dog's paw, then move up to just above the paw, in a little depression there. That's small intestine 3. Activate this area by rubbing it 5 times, take a break for a count of 5, and repeat 4 more times. It might look like this. Now, find and activate small intestine 3 on your dog's other front paw. Heart 7 is the next point recommended for separation anxiety. Heart 7 is known as spirit gate. Research has shown that Heart 7 has a positive effect on brain function. In addition to helping with separation anxiety, Heart 7 has been used for anxiety from any cause, all types of behavioral problems, lack of appetite, fever, and shoulder problems. Heart 7 is located on the heart meridian. The heart meridian governs the heart circulation, facial complexion, mental and spiritual functions. Heart 7 starts in the dome of your dog's armpit, goes down the back of the leg till it reaches your dog's wrist, right over here, and then it comes over to the side where it travels down, finally ending over here. Heart 7 is located at the outside of your dog's wrist, right about over here. And if you push in gently, you'll find you're between two bones. That is heart 7. Activate this area by rubbing it 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Now find and activate heart 7 on your dog's other leg. To close the session, activate the powerful bladder meridian just like we did a few minutes ago. Like this. And now the other side. If your dog has any signs of separation anxiety, I suggest that you find and activate small intestine 3, back stream, and heart 7 spirit gate twice a day for 30 days and then use as needed thereafter. This procedure is used to correct underlying imbalances, and it is not intended to be used just before leaving your dog or when you first return. I hope you find that this simple step will help your dog become more contented.
All right, so that is our presentation. I've reserved extra time here because I want to really answer any questions about how to do this, a wonderful procedure to help our pet friends. So Ben, if you want to read any questions we have, I'd like to address them now.
Sorry, I was muted there. Yeah, we have a few questions, and if anybody else has any questions, please use the Q&A box as opposed to the chat. And that way we can address them one by one. So the first one is, do you have a reference for caring for animals as I am caring for 3 dogs? I am often consulting Tracy Hoffman from Dr. Keppel's office, but is there a manual, maybe a ST Pro manual? What reference do you use, Dr. Baritz, if there is one?
Yeah, actually there are 2 standard process manuals available. Let me just pull one out here. So Ed, we can, I think we can just give you the PDFs for these. The first one is the standard manual. Well, here we go. So there's Veterinary Clinical Reference Guide for Standard Process Veterinary Formulas, and that's by Ron Carlston.
Yeah, I don't know if that's still in print because the SP reps are not working with that anymore because we don't work the vet line.
I see.
We have
so
no.
Then I have.
But you could Google that. Someone could Google that.
You know, but I'll tell you this. You know, the veterinary products are fabulous. They're more generalized products, but I actually prefer using the standard line because you can have much more precision in what you're doing. And I have a PDF of a veterinary nutritional handbook. I don't know if it's out of print, but I could certainly send it to you, Ben, and you could dispense it in, or I could, anyhow, Ben, if you want, I can send it to you and you
Sure.
can send that out.
That'd be great. Is that you have it on your computer?
Yeah, it's a PDF. It's like a 30-page PDF. So I'm just going to email it to you when we get through with the workshop.
Okay, thanks.
Yep.
Here's the next one. This is, it looks like just a there's a comment. It just says, I've used ashwagandha liquid and Neuroplex at home preparation for a 36-year-old spaded mixed female. That's a very old dog.
Yeah. Yeah.
But,
Ashwagandha, I'm
don't
sure.
know.
What a great choice. I mean,
Never-
ashwagandha
Most
just
dogs lived at 36.
yeah.
That's amazing.
Yeah.
Next one. Can you activate both the bladder meridians at the same time?
I don't recommend it because you have so it's important to maintain control of the animal. So one hand is guiding and controlling the dog, and just the pressure of that hand tells the dog you're in control, and then you treat with the other hand. If you're treating with both hands, then both hands also have to try to control the dog if the dog, decides to move around. And it possibly could be done, but I wouldn't recommend it.
Okay. Next one. Does this apply to cats as well?
It does. I have not started treating cats yet. I'm working with a veterinarian. I work in her clinic and provide treatments for some of the dogs there. So I'm really gaining an understanding of how it really works with animals. I haven't yet started to work with cats,
All right,
but
well,
it should. I mean, the points are still there.
Yes, and maybe that'll be in the summer or the fall session.
Absolutely.
There's some critical data, relevant data for us.
Yeah.
And then yes, someone asked if I would send the PDF file. Yes, when I get it from Dr. Baritz, I'll send it along. Any other questions? Please put them in the Q&A box. It's funny, right before we'll wait to see if anybody comes on. Someone just said, no, someone just said, I think. Sorry. Right before we came on, I was reading an article called Cell Death and Vomiting. This happens to your body if you eat poisonous mushrooms. It's from a journal talking about mushrooms. I don't know. It came from my inbox. It looked good. So anyway, I was reading it, and they said that certain toxins from mushrooms called amanitin toxins, which are very deadly. There's no known antidote.
Wow.
So typically, you either have to do a kidney or liver transplant. The only thing they know that's protective is one thing: milk thistle.
Really?
And I only bring it up in this context that, first of all, I was just reading it, a minute ago before we started. Secondly, milk thistle, of course, we carry Silymarum milk thistle from Medio. And I was saying, dogs go out and eat a lot in the outdoors this time of year, and mushrooms and things. They eat all kinds of stuff, and they come home. Sometimes they vomit and they're sick. And if you can immediately administer some milk thistle while you're waiting to go to the vet or something, just a little anecdote there.
Yeah.
And
cool.
Again, please use the Q&A box instead of the chat box. But someone wrote, when you activate the bladder meridian, would they then have to urinate shortly after treatment?
No. The short answer is no. Activating the bladder meridian doesn't necessarily stimulate the bladder. It basically activates the full function of the bladder meridian, which has a lot to do with really the spine and the nervous system.
Neurology, right?
Neurology, that's correct.
Okay, that's fantastic.
Yeah.
All right.
So, and then just in case anyone wants to know, if you start looking at this, there's actually two systems of acupuncture points on animals. There is the traditional system that's not on the meridian channels at all. And these are acupuncture points that are just developed, over several centuries, just with, veterinarians and animal caregivers, working with animals and finding points that work and understanding acupuncture. And then there's the transposition system, which is the one I used here, where the points are actually on the acupuncture points and the meridians are fairly close to, what's in the human body.
Very good. All right. Well, let's see. Oh, another come in. Yes. Milk thistle and lipoic acid can help the liver from decompensating and dying. That's exactly right, because it's it's the liver cell die-off that creates the death or the near death from these types of toxins. So that's right. That's from Constance. Thank you. So, all right. Well, coming up on 7, there doesn't seem to be any more questions. I guess it was very clear. And that's great. We love when that is like that. And we look forward to seeing everybody next week, of course. And
So let me just throw out, Ben, while we're going, if you have a dog near you or an animal, I encourage you to give these points a try and then give me a little feedback on our next webinar. We can address, how that went. Other than that, I'm good.
you gotta bow wow. Thank you. Great. Wonderful. So good. All right. Thank you so much. Have a great evening, everyone. If you're on up for it, Louis and I will be guest starring on Keith's webinar this Thursday, which is called Products, Protocols, and Procedures with Keith Wrightington, and Ben and Louis will be jumping in there. So hope to see many of you on Thursday. If not, have a great rest of your week and have fun. Bye.